This is Paul 102 Digital Wednesday. Hard Talk starts now with host Farid Ali and a special guest, Dr. Ryan Cupidore. And the topic for today, hypertension and health. Good afternoon, Farid. Good afternoon, Dr. Cupidore.
Good afternoon, David, and good afternoon to the listening public. A special good afternoon to our host, doctor, and friend, Dr. Ryan Cupidore. Dr. Cupidore, you're no stranger to us now. You've been here before.
Yes, I have.
So it's a privilege to have you again. I must say that the public was quite receptive to some of the dialogue that we carried on the last occasion. You certainly have your own way of communicating the message. So you're here a second time, it's a good thing.
Yes, to be invited back, it must be considered a privilege, and I'm very happy to have received positive feedback. So it's an honor for me to be back again.
I guess it's always important to have the correct information and from the right person. So in inviting practitioners, medical practitioners like yourself, it certainly drives the point home to the listening public as to what should and shouldn't be done in order to manage one's life and manage one's health. Today we invited you to more or less carry a discussion along the lines of hypertension and as we say colloquially, pressure. People, you often hear Australians talking about my pressure low, my pressure high, I experiencing problems with my pressure. So me being the lay person that I am, I always try to locate in terms of the articles in the newspaper, whatever reading that I can find and some of the stuff that you would have shared. But just to connect with our audience who's listening out there, I just want to read something short that I got out of the Trinidad Express. It's an old article, but some of the reading is insightful. Maybe that you can share, not necessarily in this sequence, but bring home to us in a contextual form some of what I'm reading here. I read that hypertension or high blood pressure is the main risk factor to develop cardiovascular disease. And more than 1 billion people around the world live with hypertension, which is a major cause of cardiovascular disease and premature death worldwide. It says a little bit more that cardiovascular disease is the lead cause of death, and raised blood pressure accounts for over 50% of cardiovascular disease. So sometimes when persons say to us, well, all I have is a little pressure. When I read something like that, a little pressure sounds like plenty pressure. If I could have pressure problems or blood pressure problems, and it can be a cause, it can trigger cardiovascular disease, which could compromise one's life, not just in terms of the quality of life, but it could make the difference between life and death. Then you can't take pressure problems or hypertension problems lightly. That is something I would imagine that one has to manage or monitor and then manage. You can't take it for granted. Later in the article I read, and these things break my heart here because I don't eat healthy. It says here, within Trinidad and Tobago, we have a high level of consumers who enjoy fast food, which contains high levels of sodium and fat and can be detrimental for persons already suffering from hypertension. So, I don't think I have a high blood pressure problem, me personally. But I like the sodium and the fast food and the fatty food. That makes me happy. I would imagine there are a lot of people out there with the same issue, but to marry, and I know I'm being facetious when I talk about the fast food, but if it is you're undiagnosed in terms of your blood pressure levels or or whether you are hypertension case, as we say, in layperson language, and you're eating bad, it's almost that you're striking a match in an area that is loaded with gasoline.
That is very true.
Yeah, you don't know if you have a hypertension problem, you're undiagnosed, and you're eating bad, high sodium, fatty food. It sounds like, all the ingredients, you're actually bringing all the ingredients together for a disaster. And then you run by the doctor and say, well, I didn't know all this was happening all the time, but you're laying all the groundwork for years, and then one day when you feel something strange, you're run by the doctor. So maybe we could start by you telling us what in your cultured language and your professional experience, what is exactly hypertension?
Right. Okay. So I would actually like to start off in a similar manner to the article that you just were referring to. As you mentioned, that was a bit of an older article. I actually have some updated statistics for you.
All right.
So you mentioned that 1 billion people worldwide live with hypertension, but that number actually is probably 17 to 20% of the world's population. And if you think that the world has 8 billion people today, approximately, that means that anywhere between 1.5 and 1.6 billion people live with hypertension. And that's actually scary. 1/5 of the world's population lives with hypertension. But these are numbers that I got from a data sheet referring specifically to Trinidad. We actually have a 27% hypertensive rate, which means out of 4 people, 1 person is probably hypertensive. So if you have 3 other friends, 1 of you hypertensive, statistically speaking. And what's even more scary is that up to 45% of people actually don't know they have hypertension. So they might be partaking in these not so healthy eating habits, the not so healthy exercise habits. They don't know they have blood pressure because they haven't been checking, they feel fine. Hypertension is often referred to as a silent killer because you don't often know you have hypertension until something bad happens, like the cardiovascular issues, like the heart attacks, like the strokes. And the article is very correct. Hypertension and the complications of hypertension is still the leading cause of death worldwide. This beats out cancers, this beats out all of those other nasty diseases. And hypertension is treatable. Unfortunately, out of everybody with hypertension in Trinidad, whether you know you have hypertension, whether you don't know you have hypertension, only 35% of all the people with hypertension in Trinidad are on treatment. And another scary fact, only 14% of all hypertensives in Trinidad, 14%, have control long-term of their high blood pressure. That's not a very nice number to think of. And this comes from the World Health Organization. That's a very startlingly small number. I was amazed when I was doing a bit of research for this presentation here, right? So this is why we need to discuss hypertension, because it's something that's very, very common. When you think about 1.6 approximately million people in Trinidad and 45% have hypertension, you're talking about something like 500 or 600, 700,000 there, right? That's bad, right? This is why we need to focus on what we call the non-communicable lifestyle diseases, and hypertension is a lifestyle disease. So what does it mean to have pressure? Doctor tell you have pressure. So the definition of hypertension is when your blood pressure goes over 140 over 90. So most people will be able to understand, or at least be able to remember the readings when they check the blood pressure. They will say is 140 this, 140 that, over this, or the one on top and the one on the bottom. They're pretty familiar with that sort of thing. But a one-off reading higher than 140 over 90 is not enough for us to really say you're hypertensive. There are a lot of different factors that could contribute to a single high reading. It needs to be repeated occasions where you have that high blood pressure. So what we say, we need that high reading to be repeatable, meaning if I take your blood pressure now and it's high, I tell you sit down, relax, 10 minutes later I come back and I take that blood pressure with the same machine, same situation, same room, and your blood pressure is still high, that is a repeatable high blood pressure. But it also needs to be reproducible, meaning if I take your pressure now and I see it high, and then I tell you relax for 10 minutes, and my colleague comes into the room, uses the same machine in the same room and everything, and your pressure is still high, that's what's called reproducible. So repeatable means I'm doing it all the time and it's high. Reproducible means it doesn't matter who does it, it's high. And when you have your blood pressure taken, ideally speaking, you need to have more than one reading in order for us to diagnose hypertension. And there's this phenomenon that occurs with a lot of Trinidadians, and it actually is very common worldwide. It's called the white coat syndrome. Some patients even know the name for it, meaning every time you go by the doctor and they check your blood pressure, it's high. And it's because you're a little bit anxious. You're seeing the doctors or the nurses come in with their white coats on. That's why they call it white coat syndrome. They come in with their white coats on and you get a little bit anxious. Oh gosh, my pressure might be high, my pressure might be high. All that time your pressure was normal, but as soon as you see them, you get anxious, your pressure goes up. And in that sort of situation, it's helpful for us to be able to know what your blood pressures are like at home when you're not in a clinic, when you're away from the doctors in their white coats, when you're away from the nurses, when you're away from the stress and that sort of thing. So telling us that your pressure home does be good, is only when I come clinic my pressure does be high, doesn't help us. Bring readings, let us see. That way we will be able to accurately diagnose whether you're hypertensive or not. And even if that might be an issue, there are other specialized equipment where we actually can have you strapped up to a blood pressure monitor for a 24-hour period, and at set times, they would take your blood pressure, the machine will take your blood pressure, and it will actually give us a readout of your blood pressure for a full 24-hour period. And that is actually probably the most accurate way to diagnose hypertension, but it can be impractical because you have to wear it even while you're asleep, you have to wear it while you're showering. So what we tend to do is, you come to clinic, your blood pressure is high, you say, well, your pressure doing so high, relax for a few minutes, let's check it again. And if it's still high, above 140/90, then we say, well, you have high blood pressure. And there are a lot of things that could contribute to blood pressure being high. I mentioned anxiety was one. There's a proper way and a wrong way to measure your blood pressure. So even if you're measuring your blood pressure at home, these are the things that you need. You need to have a quiet room. So a lot of the times in the clinics, the hospital clinics, the health center clinics, sometimes the doctor's office, there might be other patients around, people quarreling, oh gosh, I guess since 6 o'clock in the morning, I guess seen yet. Why the doctor doing so late? Like he going to private practice or what? They just always say that, right? So you need to have a quiet room. The area where they're monitoring the blood pressure needs to be a little bit away from the hustle and bustle and the noise of everything. You need to be relaxed for at least 5 minutes prior to measuring your blood pressure. Sometimes what happens is, especially if you're running a little bit late, you're hustling in from the car park, or you just jump out the maxi or the taxi and you're running into the clinic, and as soon as you reach, they want to measure your blood pressure. That's not the right way to do it. Obviously, the reading would be high because you've not been relaxing. So you need to be able to sit, relax for at least 5 minutes beforehand. You also need to have an empty bladder. If your bladder is full, obviously you're going to be a bit anxious because you need to use the washroom. Your pressure is going to go up. You need, and this is important, you need to have not had any sort of caffeine. You need to have not exercised a lot. You need to have not been smoking for at least 30 minutes prior to measuring your blood pressure. These things can affect your blood pressure reading. So even though we don't like smoking, we know a lot of patients still go and smoke, and they come in from outside and they want to get a pressure measure, and they vex their pressure so high, right? You need to not have had caffeine, so no coffee, no tea, no energy drinks, for at least 30 minutes prior to measuring your blood pressure. You need to sit with your back supported, uncross your legs, and have your feet flat on the floor before or while your blood pressure is being monitored. And this is the proper position because we don't want any sort of bad posture to affect your blood pressure reading. You need to have a blood pressure cuff. That's the thing that goes around your hand and inflates and squeezes your arm. It needs to be the proper size. And this is one of the most common causes of inaccurate readings with blood pressure. Depending on how big or how small your arm is, there should be a blood pressure cuff or a blood pressure balloon that will fit that. If I take a guy who's 100 pounds and I use a cuff that's supposed to be used for someone who's 250 pounds, and it's big and it's covering his entire arm, he's going to get a lower reading. On the other hand, if I have a big person, 170, 175 pounds, and I use the cuff that's supposed to be for a child and it's too tight on the arm and it squeezes, they're going to get a falsely elevated reading. So that is something that needs to be checked. Usually the nurses or the doctors will be able to determine if the blood pressure cuff or the blood pressure balloon is appropriate. You need to have your arm resting, either hanging down by the side or resting on a table. This part of your arm here, which is between your elbow and your shoulder, needs to be at the level of your heart, which if it's resting on a table or resting down at your side is the appropriate level for it to be. Very important, especially for people who measure their blood pressures at home. You need to not measure your blood pressure over your clothes. Your clothes will add points to that blood pressure and the reading becomes inaccurate. If you go to clinic and you see the nurses and them trying to measure the blood pressure and your clothes, your sleeve roll down, tell them no, that's not right. You have to roll up your sleeve. The cuff has to be on your bare arm. Another thing that I often see in the clinic, which is not right, is people talking while the blood pressure measurement is being taken. You're not supposed to be talking while your blood pressure is being monitored. When you talk, you use your lungs, your heart actually does beat a little bit differently when you're talking as opposed to when you're not talking. So please, it's just a few seconds. Try not to talk during the blood pressure measurement. And in order to diagnose high blood pressure, the ideal thing is we take 3 readings with a minute in between each readings, and we take the average of the last 2 readings. So to recap, you need to be calm. It needs to be a quiet room. You need to be relaxed, not exercising. You need to have an appropriately sized cuff. You need to be seated with your back supported. And this would apply even if you're measuring your blood pressure at home.
You mentioned tea. So often I hear people say that, you drink some tea to relax. You said you shouldn't drink tea. Did I hear you correctly?
Yes. So anything containing caffeine. So coffee has caffeine. Tea, which is like the tea bags, they have caffeine. Cocoa, a lot of Trinidadians, they like the cocoa tea. Chocolate and cocoa does have caffeine in it, right? The green teas generally have much less caffeine, and the herbal teas generally don't have any caffeine at all. So we refer to more like the tea bags and the cocoa tea here.
So drinking herbal tea shouldn't be an issue?
It should not be an issue.
You taught me something there. I've had my blood pressure read over my with the cuff, as you said, the balloon, over the arm of my t-shirt. I mean, I've not always had a doctor, I ain't calling names, but remove your sleeve and actually put it on your bare flesh. So you say that affects your reading? Yeah,
because it has to squeeze through that, and how blood pressure machines work is that they actually detect the changes in your pulse by the big artery that goes past the elbow. And if it's not able to detect that accurately, then you get a false reading. If there's clothes on, you can't feel the pulse at the proper moment over clothes. You'd feel it go beforehand, which leads to a higher reading.
All right.
Now, sometimes people take shortcuts and they say, well, the sleeve a little bit tight, just do it over and everything like that. But that really isn't the accurate way. You need to have the cuff or the balloon on your bare arm.
So often persons do these tests at home, and you mentioned that the size of the cuff is important. That your logic was that a person who weighs 100 pounds may use a certain size cuff. And somebody I would imagine who's twice that weight would use a different size. How do we differentiate as in what is the correct size? How do you know that?
Right. So on most, if not all, of the blood pressure machine, blood pressure kits that are sold out there, they will have a little label on the cuff that says, the most common body size is a medium-sized adult. So most blood pressure kits are sold with a medium-sized adult cuff. But if you know that you're a very small person, or on the opposite end, you're a very big person, most of the blood pressure machines actually have interchangeable cuffs. So wherever you purchase your blood pressure machine, you could ask them if they have extra cuffs for that machine for people with different body sizes, and you get one to adapt to your particular body size.
Now, in terms of your data, you're saying that in over 1.6 million people in Trinidad, 1 in 4 are hypertensive, which gives us a figure of around 700,000 people may be diagnosed with that sort of problem.
Well, actually, no, not being diagnosed. 45% of them aren't diagnosed. They don't know they have hypertension. So they suffer with hypertension, but almost half of them don't know that they're hypertensive. So let's say out of that 700,000, probably only 300,000 actually know that they're hypertensive. Which leaves 400,000 who don't.
In your medical practice, what is the data in terms of what is the correlationship between what we eat and hypertension? Is it that the high sodium food that we eat triggers the hypertension, or is it that hypertension exists in its own right, but the food that we eat just makes it worse? Can you trigger by your diet a hypertension problem?
Right. So it's there are different types of hypertension, which I'll get into in a little bit. But the most common type of hypertension, they've tried very, very hard to really see what triggers it. And the common thinking is that your body doesn't cope with extra sodium very well. And because your body doesn't cope with that extra sodium very well, whenever you have excess sodium in your body, it tends to elevate the blood pressure.
Wow. I was looking, while you're speaking there, I'm checking out this high sodium content in food. It mentions here, of course, this is American data, but some of the foods I'm seeing here is very relevant to us. According to the Center for Disease Control and Prevention, about 40% of the sodium consumed by, well, they're referring here to Americans, come from the following foods. But although this is referencing Americans, some of this thing here falls right on our platter, I would imagine. Deli sandwiches, that's not a new thing here, but I mean, it's flourishing all over. I mean, I can call some of the outlets, which I don't want to be sued, so, but we know it out there. You get deli food sandwiches all over. Pizza, some soups, chips, crackers, popcorn, poultry, pasta mixed dishes, burgers, egg dishes, omelets. I would imagine some of the things that we have here, nobody has anything good to say. No doctor has anything good to say about the amount of doubles that we eat and the pylori and the bacon shack. I would imagine with all these sauces that you get with bacon shack when you get to Marcus, there's high sodium content and all of that. Can you say with any degree of certainty there's a direct correlation between people, those diagnosed with high blood pressure problems or high blood pressure issues, and the things that we eat? Is it that diet is such an important factor or pull factor in terms of blood pressure issues?
So diet does affect your blood pressure, and it affects both those who not hypertensive, in that it could actually raise your blood pressure, and it affects those who are hypertensive by making their blood pressure out of control. So diet does have an impact on blood pressure, and by uh, changing around certain aspects of the diet, especially lowering the sodium content, it has been shown to lower the blood pressure as well. So there's a direct correlation between the amount of sodium in the diet and blood pressure.
Wow. Maybe you can walk us through the different kinds of hypertension in terms of the...
Yeah, so there are different types of hypertension. The first type is primary hypertension, which is also called essential hypertension. Primary means that's the primary problem. There's no real disease that has caused the hypertension. Then there's also secondary hypertension. Secondary hypertension means there's some other disease that is contributing to your blood pressure being high. For example, there are many people in Trinidad who have an overactive thyroid gland that's in your neck. If your thyroid is overactive, it can increase your blood pressure. There's also certain kidney problems that with the blood vessels to the kidneys that can lead to high blood pressure. There's also certain problems with the adrenal glands, which sit right on top of your kidneys, that can cause high blood pressure. The reason why we say it's secondary is because it's secondary to something else that's there. And the main treatment for treating secondary hypertension is treating the cause of the disease that is causing the hypertension. So I mentioned thyroid problems. The main way to treat that, yes, we will give you blood pressure medications, but to fix the blood pressure problem, basically once and for all, is to treat the thyroid, or to treat the kidney issue, or to treat the adrenal issue. So there's primary hypertension, that's the main issue. Secondary hypertension, the blood pressure is due to something else. And then there's also hypertension in pregnancy. So there are a certain portion of women who are perfectly fine, but when they get pregnant, their blood pressure goes up. And that can actually cause a big issue during pregnancy. There's a specific name for it called preeclampsia. There's also hypertension superimposed on pregnancy, or pregnancy superimposed on hypertension. That's really for the gynecologists and them to discuss. It's not really the focus of my topic on my chat today.
Yeah.
But those are the three main causes of hypertension. Primary hypertension, which is the focus of the topic today. Secondary hypertension, meaning that there's something else driving the blood pressure. And then hypertension in pregnancy.
Let me interject here with a simple question. Tell me something. Hypertension in all its different stages, if I should put it like that, happens and all of that. Tell me, is there or are there symptoms that will lead to someone knowing that they're hypertensive in the sense that some people say they're feeling dizzy. Sometimes they say it's low blood pressure that causes dizziness. Sometimes it's high blood pressure. But are there other symptoms that can say or implicate or imply that hypertension is the problem?
Unfortunately, not very many. Hypertension is referred to as the silent killer. You don't know something is wrong until something very, very bad happens. We often hear a lot of people say, as you mentioned, that they feel dizzy or they have a headache or they're starting to see blurry or something like that. The thing is that your blood pressure has to go to emergency levels of high before you start to get those symptoms. So sometimes it might be something else that's driving the headache, something else that's driving the dizziness, or it could be that your blood pressure is dangerously elevated and you probably need to be hospitalized for the high blood pressure. Usually hypertension by itself at mild to moderate levels will not cause any symptoms whatsoever until something very, very severe happens.
What about the contribution of cholesterols, whether they're too much or too little or good or bad?
Believe it or not, the body actually makes all the cholesterol it ever needs. Right? Your body is actually able to manufacture all the cholesterol that's necessary for a proper healthy life.
Yeah.
Unfortunately, there are lots of foods that are high in cholesterol, and you always hear medical professionals talk about the good cholesterols and bad cholesterols and everything like that. Having high blood pressure on its own is a risk factor for having high cholesterol levels. When your blood pressure is high, it actually causes changes in the blood itself that lead to impaired metabolism of those different cholesterols in the body.
Okay, thank you.
When we look at, you're saying that mild to moderate levels of, in terms of your blood pressure, may not show. And we only get the signal when it's really bad, or we tend to get the signal when it's bad already. It seems that what you're hinting at is that even, and given the fact that so much hypertension or persons with hypertension issues are undiagnosed, that we all should be checking our blood pressures, whether we're experiencing symptoms or not, in order to ascertain if it, for want of a better expression, if we're on the spectrum, if it is we moderate to high or mild to moderate.
Yeah, it's always a good idea, just as general health practice, to measure your blood pressure on a semi-regular basis if you're not hypertensive. But if you have risk factors, for example, if you've had a first degree relative, and by first degree I mean there's just 1 degree of separation, so mom, dad, brothers, sisters, or kids, if they have had hypertension or a complication from hypertension, like a stroke or a heart attack, you should be checking your blood pressure on a regular basis. But even if you have no risk factors, I think it's just general good health practice measures to check your blood pressure. Probably, this is for people without risk factors here, probably once every couple of weeks, once a month. It's painless. There's no needles involved. All it does is squeeze your arm for a few seconds, and that's it. It's not invasive. I wouldn't recommend, if you are not hypertensive, to be measuring your blood pressure 2-3 times a day and that kind of thing. That's taking it to the extreme. But once every now and then, I think it's good. That way you could, if there's an issue arising, you could sort of hit it on the head early.
I had a work colleague who told me that he has hypertension issues and it's severe. He had so many other comorbidities. But he was saying to me, one thing he never does, and this is the clarification I'm seeking, he said he never goes to bed until he brings his blood pressure to a certain level, until it's calm and it's where it's supposed to be. Because if he goes to bed with his blood pressure levels high, it could be more dangerous for him. Is there any truth to that? Is that just legend that one needs to ensure that one's blood pressure is a certain level before you go to bed and start resting? Or if you go to bed with high levels, then you're putting yourself in a dangerous position, are you?
Well, just by having elevated blood pressure readings, you are putting danger on yourself. I wouldn't necessarily say that you need to wait until your blood pressure is 120/80 before you go to bed. So I think that might be a little bit extreme, but definitely you would not want to go to bed if your blood pressure is something like 180/100 or something like that. Something like that could be bordering on the dangerous. You have to remember as well, when you're in bed and you're resting, your blood pressure will go down because of the 1, sleep, and 2, no physical activity.
From a personal point of view, when I'm highly stressed after, let's say, a 15-16 hour day, depending on what happens, I tend to swim at night because to me that relaxes me. Having said that, would you recommend exercise for people with hypertensive problems in order to try to get that stress out of their system and to relax, to get it done? Does exercise and measure and regulating your blood pressure levels go hand in hand?
Well, definitely. One of the first things that we will always advocate for people with hypertension is to begin exercising. We're not expecting you to run a marathon, but moderate exercise is very, very helpful because it does, in layman's terms, it remodels the heart. So hypertension affects the heart, makes you more at risk for getting heart disease. And when you do moderate exercise, I believe I mentioned in my last talk, 7,000 steps every day, right? If you do that, one, just as you said, it helps you to de-stress, get rid of some of the stress, get rid of some of the anxiety and the stress of the day, which can bring your blood pressure down. And over a prolonged period of time, if you exercise, your heart gets remodeled and your blood pressure will actually start to go down. So exercise is one of the things that we would say is perhaps number one if you're diagnosed with hypertension. Once you keep it within your limits and don't overdo it.
What about strenuous exercise? People who engage in contact sport, let us say footballers. I don't think cricket is a contact sport, but footballers, persons who went rugby, I would imagine. Um, is there Should they be careful having high blood pressure and engaging in contact sport, or it's still healthy in terms of any form of exercise? In other words, the question is there any particular form of exercise that puts you at greater risk if you're hypertensive, if you exercise in a particular field or structure?
All right. So the average person who would just, what we say, take a sweat on a weekend or something like that, does not have the same conditioning as someone who does it on a semi-pro or a professional basis. So you'd find that there are very few of these athletes who will have blood pressure problems because of the fact that they're semi-pro or professional. But the average person who just kicks a ball around on a weekend or something like that, they might find that their exercise tolerance would not be as high. Sometimes they might get what people, what we call angina, which is chest pain, or they will be easily winded. They have shortness of breath very, very easily. And what we say to that is try not to push yourself to the point where that happens. Because then you're definitely putting a little bit too much strain on your heart. So when you take it down to a lower level, over time, you'll find that your exercise tolerance will increase such that what was causing chest pain 2 months ago, you could blow that out of the water now and go past that. So it's all about tolerance and conditioning and building your body up. We don't want people to start anything extreme immediately after diagnosis.
I have an aunt who does crossword puzzles. She said that she likes to watch television and do crossword puzzles because that de-stresses her. Apart from exercise, would you say that generally doing things that can relax you, anything relaxing, some people go and cook, would you suggest that's generally a good practice to find something that actually relaxes your mind and distracts you away from the things that bother you, that to tend to assist in managing your blood pressure levels?
So there's a certain percentage of people who have high blood pressure where the mind does affect the blood pressure. So stress, anxiety, just day-to-day hassles do send their blood pressures up. And for those people, relaxing activities, crosswords, the television, reading, cooking, that will help that particular portion of people more than it would help someone whose hypertension is not really affected by stress.
All right.
Right. Yeah. So, like I said, we were talking about it in terms of what happens with high blood pressure. You mentioned in the article about people with cardiovascular disease and hypertension contributing to it, right? And cardiovascular disease actually hypertension accounts for more than half of all deaths from cardiovascular disease. And again, that's a scary statistic. But I mean, how does that really happen, right? Those of us who were interested in science and stuff in school, we would have learned that the heart is a muscle. But what happens when you have this high pressure inside your blood vessels and inside of the heart? It's the same thing that happens to any muscle when you put that muscle under stress. You put a muscle under stress, for example, you lift weights or you weight train and everything like that, you want the muscles to get big. That's what happens to the heart. Your heart is a muscle because your heart is under strain from the high blood pressure, it gets big. And you get what some patients will refer to as, the doctors say, I have a big heart. Right? We're not referring to your romantic or emotional intelligence here. Your heart is physically bigger because the muscles are big. And when the muscles get big, they decrease the size of the heart chambers. So there's not enough room to pump the amount of blood that's coming into the heart. And then you get what we call heart failure. So you get the shortness of breath, you get swelling of your legs, you get a lower exercise tolerance. And when you have more heart muscle, more muscle means need for more oxygen. And if your heart, which is the pump of the body, doesn't get enough oxygen, that's when you start to get chest pain. That's what makes you at risk for certain portions of the muscle to die and get you having a heart attack. So just by having high blood pressure with the heart having those changes, we call them hypertensive heart changes or hypertensive heart disease. Just by that in itself leads you to having a higher risk of heart failure or a heart attack. Then that's just one organ, right? Cardiovascular disease also includes cardio, heart, and vascular means blood vessels. Hypertension is a major cause of strokes. And for a number of years back in the day, they always thought there are two types of strokes, right? There's one where you bleed into the brain and one where the brain, parts of the brain doesn't get enough blood. And back in the day, they used to think, well, hypertensive people tend to get more of the bleeding in the brain type, because what happens when you have a high blood pressure in your blood vessels? If you ever heard the saying, pressure does bust pipe, your blood vessels are pipes, right? And that was the thinking back then. But actually, because of the fact that high blood pressure leads to problems with cholesterol and everything like that, high blood pressure contributes just as much to the type of strokes where you don't have a good blood supply as it does to the ones where you bleed. And we all know how debilitating strokes can be, and it places a burden both on the patient, but sometimes just as much or even more of a burden on the caregivers, because if someone is perfectly healthy beforehand and they get a stroke and now they're bedridden, and we're seeing strokes in younger and younger people nowadays, people in their early 40s getting strokes, debilitating strokes, bedridden. Someone who's 40 is in the prime of their work life. All of a sudden, they're no longer able to go out there and earn, and it affects an entire household, and now their spouse or significant other has to care for them because they're not able to move about, all because of uncontrolled hypertension. So that's the heart, that's the brain. Hypertension also affects the kidneys, and hypertension leads to changes in the blood vessels of the kidneys, which could lead to a loss of renal function. Now, the kidneys are basically the filters of the body. So your body, just by regular daily activities, produces different waste products, and they're filtered out by the kidneys, and you pass them out in your urine. If the kidneys are not able to filter out these waste products accumulate in the body and could cause very, very significant issues. And in worst case scenario, you end up on dialysis, which is where you have to be hooked up to a machine 2 or 3 times a week for about 3 or 4 hours in order to do the job that the kidneys would normally do. So that's another organ that's affected by hypertension. And one of the organs that we as physicians like to examine when we diagnose someone with hypertension is the eyes. And the reason for that is because the layer behind the eye, your retina, we could actually see it if we use a special tool. Those of you who've ever been for an eye test or anything, when they shine the light into your eye and look through the device, they're actually looking at your retina. And the blood vessels behind the eye are particularly sensitive to changes in blood pressure. So if you have just mild to moderate hypertension, chances are you're not going to get significant visual disturbances or significant visual loss. But because of the fact that these blood vessels are very sensitive to changes in the blood pressure, we could be able to determine or estimate that you've had blood pressure for a while now, as opposed to, well, your blood pressure hasn't affected your eyes yet. That means that the blood vessels in the rest of your body may not be as affected. The blood vessels in the eyes give us an indicator of the blood vessels in the rest of the body. And they're very easily visible. Again, it's a non-invasive test. You just get a little bit of a glare from the light shining into your eye, but it's not painful. And it's one of the things that we generally like to do in order to monitor high blood pressure. We either send you to an eye doctor to get a formal assessment, or in some clinics, the actual doctor themselves, they have the tool that could look into the back of the eye in the office itself. So those are some of the blood vessels. I'm sorry, not blood vessels. Those are some of the organs that could be affected by high blood pressure. So as you were saying, I have a little bit of pressure, I'm feeling good, nothing wrong with me. Look at all the different complications that could have happen to you just from having high blood pressure.
You mentioned earlier that you could. Oh, David, go ahead. Go ahead.
Does yes, doctor, tell me, does hypertension affect male and, well, mostly male and female, where sexual intercourse is concerned? Like
Yes, so having high blood pressure does, like I mentioned before, it leads to impaired processing of cholesterol and everything like that. So you could actually have the same way how you have before a heart attack cholesterol deposited in the blood vessels by your heart, you could have cholesterol in the blood vessels down there. And you could get a narrowing of the blood vessels. And as I believe I mentioned in my first lecture, not lecture, discussion on erectile dysfunction, having a proper blood supply to the organ is essential in order for a guy, especially, to function in bed. So yes, it can affect sexual function.
thank you, doc.
You mentioned earlier that if your pressure isn't managed properly, you could either get one of two strokes. One that could cause you to bleed into the brain, and the other being the brain not getting enough blood supply. So, am I correct in what you're saying, and interpreting what you're saying as, if your blood pressure is high, that can lead to bleeding into the brain, and if your blood pressure is low, or if it's not, I'm using high and low like a lay person here, and if your blood pressure isn't managed in a particular way, then it could be the reverse and still be lead to a stroke, which is not enough blood going to the brain itself.
Yeah, so generally speaking, the type where you bleed into the brain is as a result of very, very severe, very, very uncontrolled high blood pressure in an instant. It happens just like that, generally speaking. So that's the bleed. The one where the brain doesn't get enough blood is a more slower burn. It's like a fuse that's just burning, burning, burning until eventually there's a blood vessel totally blocked off, and that part of the brain does not get enough blood.
But this, from what you're describing, this is so intricate and intense. So it's almost as if it is, from what you're describing, monitoring blood pressures and regulating blood pressures. If it's too high, you can bleed into the brain. If it's too low, not enough blood is getting to the brain, so you can get a stroke. for different reasons, still related to blood pressure. So it's almost as if you have to chemically or in some way manage your blood pressures to be at its optimum level at most times.
Right. So let me just correct you there. There's not like if it's too low, the brain isn't getting enough blood. The reason why the brain would not get enough blood if you're hypertensive is from changes in the blood vessels itself.
Okay.
So you would have heard like people, you have plaques in your arteries.
Yeah.
Or you have cholesterol in your arteries. Well, your heart is not the only organ that has arteries. Your brain has arteries as well. So by having an elevated blood pressure for a long period of time, again, the cholesterol levels in the body tend to not be processed as well. So your cholesterol tends to be a bit elevated, and this can be deposited in the blood vessels into the brain. So it's not about low blood pressure. It's just about having that high blood pressure for a period of time where slowly but surely the middle of the artery gets smaller, 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 smaller until there's no blood that could flow through that artery.
And the cholesterol could cause that. The cholesterol
Yes,
could cause that plaque buildup.
that's usually caused by the cholesterol, which is affected by the high blood pressure. Because hypertension is an independent risk factor for having high cholesterol.
We are talking high blood pressure, high blood pressure, high blood pressure. I've heard about people who have problems with low blood pressure. Is that something of concern?
So yeah, there are a lot of Trinidadians who always say, "Doc, I just suffer low pressure." Here's the thing: low blood pressure is not actually a medical thing, right? Your blood pressure could be 90/60, and once you're perfectly up, fine, functioning, and have no symptoms, that's your normal. You live with it. Low blood pressure only becomes a problem when your organs do not get enough blood. So when your heart doesn't get enough blood, when your kidneys don't get enough blood, when your liver doesn't get enough blood, when your brain doesn't get enough blood, because the blood pressure is that low, then that is what we would call significant hypotension. So hyper means high, hypo means low, significant hypotension. So low blood pressure, as most people would walk around, I just suffer low blood pressure. Well, you're walking around. That means your blood pressure, that is your normal.
What are the consequences one can expect when people say, okay, your blood pressure low, eat something salty? What kind of effect that will have, knowing that salty stuff or sodium intake of that level can bring about high blood pressure?
Again, so low blood pressure only becomes a problem when you have symptoms. So different people have different normals. So for example, when I was a teenager, my normal blood pressure used to be 90/55 or something like that. Now, some people might say, oh my goodness, that is so low, but that was my normal. I was able to function. I wasn't dizzy. I didn't have a headache. Nothing was wrong with me. That was my normal. So different people have different normals, and you don't treat a number, you treat a patient.
Okay, so the people who walk around are saying that the use of garlic to bring it down and the use of salt to take it up, they are on the wrong page, I can say.
So there's certain times when actually we have told people to eat a salt prunes, right? We literally told them to go and suck salt, right? And that isn't a very common thing though. Usually they would have had a problem with actually having low sodium levels in their body, and that might have contributed to the low blood pressure. The other thing you mentioned is garlic, and garlic is one of the more famous herbal remedies that Trinidadians like to say works for high blood pressure. And I actually did some research on that, and there is some evidence, meaning they actually took a bunch of people, divided them in half. So half took garlic, half took conventional blood pressure medications, and they studied the effects on it. And there is actually some evidence to show that garlic can lower blood pressure. However, it's not a predictable effect from person to person. So One person might take it and their blood pressure might drop by 5 points. Someone else might take it and their blood pressure might only drop by 2 points. When we give people medications, we give a certain dose, we expect a certain effect.
Yeah.
So the effects are not very predictable with those sort of supplements, such as garlic. I also found that fish oils actually do have a little bit of blood pressure lowering effect as well. So things like the cod liver oils and the shark oils, capsules, that did have some effect, but again, it was not very predictable. And of course, it shouldn't be a substitute for a healthy lifestyle and medications, actual proper medications that have a predictable effect.
Okay. Now you spoke earlier on about people who do their checks at home, and as compared to going to clinics and stuff. Now, is there a standard uh, 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 or something that is recommended that you should observe or use to measure your blood pressure? It's now that you said that people are different in their genetics and all of that. Normally, I know people. I used to be close to people who would feel that kind of when they run, pick up their device and wrap it around their arm, anxious. So I used to always tell them, like you said, but you can't do it being anxious. It's best you sit down and relax and then try. But sometimes they so find they're feeling this kind of way, they need to do it now. Now, you mentioned even the different body masses and the types that you should use for your particular body, whether you're small, medium, or large. Now, with all that in mind, is there a standard, like you said, 90 over 95, over 55? Isn't there a standard that will enable everybody across the board, big, small, medium, as to what it should be, that an accepted standard for measuring your blood pressure?
So again, different people will have different targets, and your doctor will be able to let you know what your initial targets are, what your end goal targets are. But the general accepted guideline for target blood pressure, if you are hypertensive, this is only for people who are hypertensive. So if your blood pressure has been measured more than 140 over 90 on more than one occasion, and you on either medications or lifestyle and medications, your target would be 130 over 80 or less than that. Right? If you're not hypertensive, we still want the 120 over 80. But this is if you are hypertensive, your end target is 130 over 80. If your blood pressure is way up in the sky and you started off very, very, very high, then your target would be obviously a little bit adjusted. So generally, if you start off at a very, very high level, we tend to aim for a 20 over 10 reduction within a 3-month period. So if your blood pressure was like 190 over 110 all the time, regularly, it's a bit of a stretch to say we want to get you down to 130 over 80 in 3 months' time. So what we will say is in 3 months' time, you were 190, we want you at 170. You were 110 on the lower number, we want you at 90. And then another 3 months, we get you down from 170 to 150. We get you down from the 100 to 90, or 90 to 80. And within 6 months, you went from 190 over 100, 110. You're now down to about, let's say, 145 over 75, 85, somewhere around there. It's still not the 130 over 80, but because of the fact that you started off so high, we cannot realistically expect to drop your blood pressure so dramatically, so quickly.
So, like, let's say, like someone who goes to their general practitioner and probably did a blood pressure test, and the doctor will just say, well, you are this and you are that. Is it advisable that someone, it might be advised to the patient too that you get the device and keep it at home and you do it, like you said, whenever it's needed or how regular you think it's going to work for you? So like someone who just feels like buying the device, you wouldn't advise that. You should have a practitioner let you know about your measurement before you buy a device?
Well, the thing is that the devices have gotten more and more affordable and more accessible recently over the past few years.
Yeah.
So if you can afford it, there's no harm in having one. But I wouldn't really tell everyone go out there and get one. It's nice to have one in every household though, because like I said, one in every 4 people, if your household has 4 people or more, chances are one of them are hypertensive and would need the machine anyway.
Yeah, yeah.
But if you don't really want to purchase a device, or you feel that it wouldn't be a good investment, and you still want to check your blood pressure on maybe once a month or so, a lot of the pharmacies have the blood pressure testing. They also check, I think, your weight and height and everything like that as well for something
Okay.
like a few dollars. You
Yeah.
could do that.
Yeah, yeah. Okay, thank you so much.
No
For it.
problem.
What is the relationship between smoking and hypertension? Does smoking, every doctor tell you smoking puts you at risk for something. Is there an increase or higher risk when you're a smoker and hypertension and a hypertensive condition?
Smoking does increase your risk of hypertension, and smoking does increase your risk of cardiovascular disease, as well as about 10 different cancers. So yeah, smoking is a big no-no. And actually the nicotine in vaping, those electronic stuff that people use, that could actually raise your blood pressure as well.
Have you all as doctors made that very known to the public? Maybe I missed something. I know that you always say that smoking is a risk factor for just about everything. I mean, you've driven the point home now. But vaping in particular has become, it's a fad. I mean, it's picking up. They tell you switch, nicotine will kill you. So it's almost like they're suggesting an alternative is vaping. How would you correlate smoking and vaping? Is it vaping just as bad as smoking cigarettes and nicotine intake?
So I personally would call it just as bad, right? There are people who would say, well, it's safer because you're not getting all the tar and all the particulate matter down into your lungs and everything like that, but you still are getting nicotine. And even if you want to use the nicotine-free ones, the vapes usually use something like glycerin or something like that, which needs to be vaporized. And there are no long-term studies on the effects of inhaling those things as yet, like long-term major studies. So we need to see what happens in the next few years as more data comes out. But it could potentially lead to lung disease in the future, and potentially different lung disease than traditional cigarettes.
Wow. When we look at right now, I always ask this question. Since 2019, we decriminalized the use of small amounts of marijuana. So it's not forbidden for me to ask. For those persons who are taking advantage of the decriminalization of small bits of marijuana, and they have their 4 plants at home and smoking weed, as they say, the smoking marijuana puts you at a higher risk. Because I've heard, I could say this, I've heard from some of the sporting friends that when they smoke weed, they're more relaxed and they perform better in terms of the footballing talent and cricket talent and so on. In other words, they're better athletes when they smoke and relax. Is there any risk involved in smoking marijuana and a hypertension situation, or we need more data and a few more years for that?
So I don't know offhand of a correlation, but I would want to think that it would actually decrease your blood pressure a little bit because of the relaxation and because of there's a certain effect that marijuana has on the blood vessels where it causes them to be a little bit dilated, a little bit bigger, which is why you tend to get the red eyes when you smoke marijuana, because the blood vessels open up a bit. And that could potentially decrease your blood pressure. But again, don't quote me on that. I haven't actually researched that in depth.
I'll leave that for another occasion and a little more information from my point. But I've heard, just as sticking a pin, I've heard that, and I've seen where I have some friends who smoke weed and they're out of control when they do it. So that you're saying that sometimes that relaxes you. I've seen in the reverse where people
The opposite.
hyper. Yeah.
Right. In which case, their blood pressure will probably be elevated.
Yeah. So to the listeners out there, I guess they should still err on the side of caution. It may not be a good practice to say you're taking your blood pressure down by smoking weed. They should actually do some more research into that rather than presume it does and something else happens.
Yeah, agreed.
What about alcohol? Everybody drinks, or most people drinks. Does people say when they drink, they relax? After work, you go and take a drink. Of course, if you spend all evening drinking, that's a different kind of problem now. But is there any correlationship between managing your hypertension and alcohol intake?
So if you are not hypertensive and you consume alcohol regularly, a little bit more than usual, you are at a higher risk of eventually developing hypertension. And that has to do with alcohol's effect on the blood vessels as well. It actually kind of makes the blood vessels a little bit less elastic. So every time your blood pumps through your blood vessels actually supposed to open up a little bit. That's why you're able to feel your pulse by your wrist. It's as your heart beats, it actually opens up the blood vessel a little bit and it comes with a little beat. If you drink alcohol to excess, your blood vessels lose some of that elasticity and they're not able to stretch as much. And if they're not able to stretch as much, the pressure within them tends to be elevated. So alcohol can contribute to development of hypertension.
Well, I don't mean to be the devil's advocate here. I have friends who tell me that what they do is they drink refined alcohol. They drink high-end liquor. They're not drinking dog shampoo, cheap stuff. So is it that, I'm not being facetious, I'm just trying to be clear here. Is it that there are types of alcohol or levels of alcohol or brands of alcohol that is more refined as opposed to cheap alcohol that could cause that sort of problem? It's just alcohol generally, regardless of whether it's refined alcohol or not, that can cause the effect it has on loosening the elasticity in your blood vessels.
So the active ingredient in all alcohol, from beers to puncheon, is ethanol, which is what they put as the percentage on the label, right? Whether it's 5%, 10%, 15%, all the way up to 75% for puncheon, right? It's ethanol. When you refine alcohol, you're not doing anything to the ethanol. The ethanol is still there. You refine the other things in the mixture itself. So the ethanol's effect does not change. So a 40% bottle of, let's say, scotch that's 1 year old, right? As opposed to like a 10, 15-year-old bottle of Johnny Blue, right? Still has 40% alcohol in it. Still has 40% ethanol. Still has the same effect on your blood vessels. You might feel better. You might feel like, you're drinking something nicer and everything like that. But that comes from the other things besides the ethanol that's in the mixture of liquor.
Let me read a comment here. David Charles is saying, this doctor is doing so much for our country's citizens. I'm hoping the Ministry of Health is taking notes or hospitals should have consideration for his contribution to the general public. All right? Now, that's said and done now. Doc, tell me something. People like you and Fareed, even myself, including myself, would be more seasonal than you guys. You guys do this thing every day. Sometimes my job, like during Carnival, the Christmas period, the Easter period, will have a boost in your eye function. Okay, that entails you not sleeping enough and all of that. It can have an effect on your nervous system, and what kind of relation or what kind of effect will have where hypertension or hypotension is concerned.
Yeah, so actually, the incidence of hypertension in medical practitioners is pretty significant because of the long hours, because of the stressful situations that we're in. You tend to have a good portion of doctors who have hypertension, and there's this saying, doctors make the worst patients. So believe it or not, some doctors actually, they don't like to get their blood pressures checked because they're afraid that when they check it, it's going to be elevated. So there's also some doctors who have hypertension and don't know they have hypertension because they don't be checking it. So it does exist, and it's a significant portion, especially as, we start off all bright-eyed and bushy-tailed, as they say, in our internship, and then we eventually move up the ranks and get more responsibilities and more pressure, more stress on us, and it leads to hypertension, among other things. There's also a lot of actually mental health issues among doctors, among medical practitioners, which could drive hypertension because of the stress, because of the anxiety, sometimes because of the depression, that sort of thing.
Right. So where rest is concerned, you doctors say make sure you get 8 hours rest, but you guys don't get that. And like around carnival time, I don't even dream about that. So where does rest play any kind of factor in contributing or assisting with lowering the blood pressure or making it worse or elevating it, as you said? Rest.
Yeah, a good night's rest and the amount of time that you require for sleep actually decreases as you get older, which is why you would find some elderly people might sleep 3-4 hours for the night and they're fine. Whereas we all know babies sleep for the whole day. So generally speaking, for people for much of their adult life, which I would say from early 20s all the way up until, like, let's say the age of 65 or so, you would generally need between 6 and 8 hours of sleep a night. What a lot of people do is they don't get enough sleep during the week, and then they say, oh, I'll catch up on the weekend, or off Saturday, I'll just sleep in Saturday. That's actually not really proven to work that much. All you're doing is you're just sleeping, but not actually adding too much to your sleep cycle. But what happens with people who, on a long-term basis, generally sleep less, what happens to our sleep patterns is that the amount of time we spend in deep sleep changes. So deep sleep, when your body actually rests and recharges itself, people who on a long-term basis get less hours of sleep in spend a longer period of time in those deep sleep stages as opposed to lighter sleep. So I always tell people, I mean, I could fall asleep anywhere. I once fell asleep leaning up on a lamppost. Right? A good sleep too. Right? And that's the thing with people who they take their sleep when they could. They've learned to get their body to fall asleep quickly and get into that stage of restful sleep, such that when they wake up, they've spent more time in that restful sleep period. But generally, if you're hypertensive, what we say for most of your life, you need between 6 and 8 hours of sleep. We have this bad habit of taking the cell phone to bed with us and watching some of those videos on those websites or streaming something or having the TV in the bedroom. And when you next thing you know, the TV watching you. That's not proper sleep hygiene. You really should, if you're going to bed, make sure you're actually ready to go and sleep and don't stay up until all hours of the morning watching one more video, one more video, one more video.
Okay, okay. Understood, understood. Well, a lot of comments here that are asking for you to come again. I don't know how much you can explain anymore because I've absorbed so much. I mean, since you were here the last time and today. So I am very happy that you're here. I told Fareed that you're the best we've had. So I really appreciate it. So Fareed, what's your question now?
Sometimes when I travel, in like I remember experiencing it for the first time when I was in Spain. They have these siestas in the afternoon where everybody, there's no work, people go home to take a rest. Would you recommend? I really never got a full explanation in Spain as to what is the science behind that. But my questioning is this to you: would you recommend in terms of resting and for us as Trinidadians to take a rest? As we say, we have this expression, you take a 5 in the day. Would you say that taking a rest in the day would assist in terms of managing hypertension or blood pressure levels?
What does it equate to night sleep?
So it's not a replacement for sleeping any night. And if you do take a nap or a 5 during the day and you find that in the night you can't sleep because you slept in the day, then you should cut off the naps during the day. So I always grew up with my grandfather. After he finished eat lunch, he had to go and take a little dodo, as they say, right? He would sleep from 1 till about 3 and then wake up. And then he would still go to bed at a normal time, maybe 10 o'clock in the night, and wake up probably about 5:30, 6 o'clock in the morning. So if it does not disturb your nighttime sleeping pattern, there's no reason why you shouldn't. You'll find that your body becomes a little bit more relaxed. And this can actually help with your blood pressure throughout the rest of the afternoon period. I don't actually have like numerical values or any actual data. So this is just like an anecdotal sort of thing for me. But I would think that it would help in terms of relaxation and help with lowering the blood pressure a little bit.
Right. So it's quite possible that in countries where they have these afternoon siestas, that it may very well be that I'm not asking you to speak to the culture that is there, but scientifically, a rest in the day could assist in terms of us managing or blood pressure levels. It brings us to a point where we can take things down and go again.
Yeah, so I mean, just having that ability for both your mind and your body to sort of reset itself is often very, very helpful mentally and physically.
A lot of people talk about mindful eating. I don't know if you ever came across that phenomenon. We eat on the go here in Trinidad in more ways than one, right? You work all day. Some people, you wait till you're hungry to start eat. And then you buy fast food and you're eating while you're driving. And you take it, you're biting off, you're just eating, you're stuffing your mouth with something. And would you say that culture of eating fast food and eating food on the go and not actually sitting and relaxing at a table, that has an impact? That, in other words, the way that we take our meals, we should be more. It should be structured. It should be at defined periods in the day. Or this thing about you just eat when you can and whatever you have at this food. So not necessarily unhealthy food. It's just you eat whenever you feel it and wherever you are. Would you say that taking the time to relax and then eat and enjoy your food assist blood pressure levels, or that way that we eat here where everybody just food on the go it has no effect? Is there a correlation in how we conduct our meals and our blood pressure levels?
So there is a correlation between hunger and food choices. So the hungrier you are, or the longer you've spent without having a meal, you tend to choose or make meal choices that may not be the best for you. And the fast foods are one of them. And part of it is convenience as well. Not everyone gets up 4 o'clock in the morning to cook, put food in a container, carry it to work, or cook the night before and everything like that. When it's so convenient, there's a fast food outlet right around the corner from your workplace or something like that. So it's a combination between the convenience of it and also the choices that you make when you're hungry. So you said the actual sitting down and enjoying your meal, relaxing. It's actually been shown that the longer you take with a meal, the less you tend to eat, because you're relaxed and you're actually focused on what you're eating. When you're on the go, you're not focusing on both what you're eating and how much you're eating. And that causes you to both eat more and eat things that might not be the healthiest for you. So the amount of sodium, of course, we know in some of these fast foods, all the deli meats and the chicken and fries, the pizzas, the noodles, everything like that, the Chinese food.
The gyros.
The gyros, those things are sky high in sodium, right? I mean, that's what makes it taste good, right? If you were to actually have the opportunity to sit down and make a meal for yourself or stand up and you're cooking, you wouldn't, I can't tell you last time someone I know fried chicken at home for their family, or someone I know make Chinese style noodles at home, right? Where you control what's going into the food, you control how much salt, how much sodium that's going in. And the other upside to it is, your taste preferences, you make it to your taste preferences. But people just generally don't have that time. And when you eat all of these convenience food without knowing what's going into it, it will drive your blood pressure up. Because even some of the healthier options or the alleged healthier options, right? People say, well, I'm trying to be a little bit healthy. I'll have a salad. And then they drown it in a liter of salad dressing that has who knows how much sodium in it and fat, right? But you're having a salad, so you think it's healthy. Whereas it might have been healthier to just eat the fries.
As you're talking about that, I think commercial cooking is something that, I try not to eat as much fast food as Fareed. I'm a kind of homegrown kind of guy. And I think some of the ingredients they use for flavor has a lot to do with the aiding and abetting of elevating your blood pressures, because you see them have all these kind of different powders. You don't know what it is, and it might not dissolve. For instance, like black pepper, I can just point finger to that. To me, that don't dissolve at all. So I know that too can aid in elevating your blood pressures. All right. Don't answer yet. The same David Charles is saying, I know this, doctor. Over 3 years, I suffered from prostate cancer and I'm completely recovered. He's not a know-it-all, but helps with diabetes also. Please call to live long. I thought that threw that in the mix. Now, that what I said, I wanted to elaborate on that about the variety of artificial flavors, I call it, that, especially Chinese food, they use a lot of that. But people who cook commercially, they don't have time to go to a marketplace and buy a lot of freshly grown seasonings, right? Answer that and then tell me, how does high blood pressure or elevated blood pressure, I like that term more than high blood pressure, is that responsible for mental health or mental health problems?
Okay, so the first part of the question was about the different types of seasonings and stuff like that you would find from the commercial food sellers, and that is true. So a lot of them don't have time to go and grind up for green seasoning and all them thing when they have a powder that they could use. Or nowadays they're selling green seasoning in the grocery, not just the bottled ones, but they're selling them in a little foil pouch, right? Right? And You don't know how much salt going into that. You don't know what other ingredients going into that. But they're using it because it's fast, it's convenient, they have large volumes to cook. The number one best way to control what's going into your food, I'm not telling everybody to plant a garden, although they should at least grow a little something. But you get your ingredients yourself and you add it according to your liking and according to what your good health practices are, which you and your doctor would be able to discuss what's good health practice in terms of diet. The second part of the question was about
Mental health problems.
right. So hypertension itself will not necessarily cause mental health issues unless you are one of those very, very anxiously worrying types that your blood pressure must be absolutely perfect and everything you do is like you're a bit obsessive over it. So that probably was not caused by the hypertension. I was probably there before, but having the diagnosis of hypertension kind of unmasked it. The type of mental health issue that we would see commonly with hypertension is dementia, right? Or what Trinidadians would say, senile. And that is a steady or a decline in mental function over a period of time. And the reason for hypertension contributing to that is because you have what we call vascular dementia or vascular senility. You've had a lot of mini strokes in your brain, and those mini strokes have affected your ability to function properly, especially with the higher sort of mental functions. So general mental health, not so much, but like dementia and senility, hypertension does contribute to that.
Okay, what about people who spend lots and lots of hours studying late at night?
So people who spend lots of hours, again, the lack of sleep would be a little bit stressful on the body. The always, going on the mind. That could also drive the blood pressure up a bit. One thing that I will have to add, people who study in late, they tend to drink, a lot of caffeine, a lot of energy drinks, the different brands of energy drinks out there. Those energy drinks do send your blood pressure pretty high.
That is something I've never drunk. And I don't intend to. I tell them I'm a country boy though.
So those energy drinks, actually, you may not be hypertensive, right? You may not be like a chronic hypertensive person, but you have too much energy drinks. It can send your blood pressure into the dangerous levels just for a few hours, but that few hours could be enough to cause all kinds of drama.
Right. I understand. Fareed.
What about fruits? We're talking about foods and how they are prepared in terms of high sodium content, but are there fruits that you would recommend that it's more suited to managing your pressure levels? Is there any particular fruits out there that you can recommend?
Off the top of my head, not so much, but of course, couple servings of fresh fruit a day, right? And fresh meaning, like you actually bought it and cut it yourself, is always a very good thing. We like to say eat colorful things. So the more colors you have, like in a little fruit bowl or something, the more colors you have, the better for you. Fruits, nuts, raisins. If you don't have access to the fresh fruit, you can use the dried fruit, but try not to get the dried fruit that's been coated in a bunch of sugar and everything like that. Try to get just a plain dried fruit. So they're like dried cranberries, dried peaches, the dried pawpaw. There's a few good options for dried fruit if you don't have access to fresh fruit. But this being the start of rainy season, this being mango season, fresh fruit is always preferred.
When you mentioned nuts, we consume a lot of fried, nuts that you're selling on the road for $6 in the traffic. You're referring to raw nuts?
Well, certain nuts do need to be cooked, but there are certain like I'm not talking about like peanuts here, but talking more like, like cashews, almonds, that kind of thing. Because almonds, I don't believe they fry almonds. They do cook them because you can't eat raw almonds. They're poisonous. They have cyanide in them. But when you cook the almonds, they're pretty good. So almonds are good. Cashews, walnuts, pecan nuts, Brazil nuts. Not so much the fried peanuts too much. We always like, our nutsman peanuts, but try to limit that in particular.
Has there been any studies done on music and how it impacts on your blood pressure levels? I've heard it been said that what we listen to, and music is a part of it. There's a correlationship and how the body responds to different kinds of music. Let me say it a different way. In some schools, when you're dealing with early childhood education, they play Mozart and Beethoven and this sort of serene, sort of relaxing music, and they say that lays the background for mindful learning and puts the child in the frame of mind where they can focus and process and so on. And this may not be your area, but I'm still asking if you have any knowledge of that. Is there a correlation between how we manage our pressure levels or blood pressure levels and the things that we look at in terms of movies and or the music that we listen to? In other words, or the oral intake of things around us. Another way of saying it is, some people like myself, I'm quite relaxed when I go to the beach and I walk up and down the beach and listen to the ocean. Is there any relationship between the things that we see and hear and what appeals to our senses and our blood pressure levels, which is inclusive of the music and the things that we listen to?
Right. I'm not too sure about blood pressure specifically, but I know that they did look at heart rate and different types of music. So, they did like, the classical stuff. They did the stuff you might hear on a regular mainstream radio station. And then they went to the extreme with the heavy metal rock music and everything like that. And they measured people's heart rates. And definitely the more aggressive the type of music was, the faster the subject's hearts beat. And I would think it wouldn't be too far to extrapolate that the blood pressure would also be increased in that sort of situation as well.
We just came out of the coronavirus COVID-19 situation. Some people say it's still there. Maybe it still is. Was there an increase in your medical experience increase in hypertensive situations and the COVID-19 virus and those who had it and didn't have it?
I can't say for sure because I don't work like in primary care. So primary care would be more like, the health centers and that kind of thing. Those are the people who would tend to see the regular hypertensive patients. I can't say for sure whether there was a increase in people who were newly diagnosed with hypertension during the pandemic. What I can say is that any illness that occurs to you when your body is trying to fight off an illness, it tends to go into a little bit of overdrive. And sometimes your blood pressure could go up very, very slightly. But once you recover from the illness, it will go back down to normal. So I really can't give you too much information on that, but I could, research it and maybe at a later date, just mention it to you.
I'm not trying to put you on a spot. What about, and forgive me because I was in reading, preparing for this. What about persons out there who are HIV positive? It's no longer a deadly disease from what I've read, but I'm just saying, should persons of that nature or that diagnosis who are out there listening to us, does it in any way impact on how their condition in terms of blood pressure levels or having hypertension with that? Does it put them more at risk? Uh, what sort of correlationship there is there between that?
Right. If you have HIV, you're at a very, very slightly higher risk of developing hypertension because having the virus in your body leads to your body always trying to, trying to fight it up. The virus fighting your immune system. That kind of internal war is happening inside of your body.
Right.
So you do have a slightly higher risk of having hypertension. If you do have HIV and you have hypertension, you are at a higher risk for the complications. So the heart attacks, the strokes, the kidney problems, because HIV in itself, because of this war that's happening in your body between your body and the virus, that in itself is a risk factor for heart problems, is a risk factor for strokes, is a risk factor for kidney failure. And then you add hypertension onto it, which is another risk factor. Now you have two risk factors. So if you are HIV positive and you have hypertension, we tend to be, pretty aggressive with treating your hypertension, and we would also want you to go to your HIV clinic and make sure that your levels of the virus in the body are at a acceptable sort of level.
I would imagine that would apply to anyone with any sort of comorbidity. I mean, even if we are moving away from this HIV situation, once you have a primary condition, then high blood pressure married to the primary condition could be,
it definitely
a spark over gasoline.
Definitely. So it's becoming more and more common for patients in Trinidad to have what we call, the big three: hypertension, diabetes, and high cholesterol, right? And when you have those big three, you would think that your risk of stuff might increase 1, 2, 3 times, right? It actually doesn't increase 3 times. It actually increases probably about 5, 6 times. They don't add on, they actually multiply among themselves to give you a higher risk of having all of these issues like heart problems, like kidney problems, like strokes, like, with diabetes in particular, amputations, that kind of thing.
It's been interesting, some of the things you're raising here. I mean, we take for granted our health generally. I mean, I'm not just saying it's a Trini thing, but I guess it's a people thing. We try to live our best lives, and the best lives for the average person is doing what makes them happy and not what makes them healthy. So the correlation between health and happiness isn't always
No, it just because you're happy does not necessarily mean that you're healthy. And I would say for any person, once you're approaching middle age and afterwards, even if you think you're absolutely healthy, it's a good idea, once a year at least, go get a checkup. It doesn't have to be anything fancy, but, get your blood sugar checked out, get your blood pressure checked out, find out what your cholesterol levels are, so that even if nothing is wrong, you know that nothing is wrong. And if something is wrong, we could be able to address the issue earlier rather than later and prevent the complications, as opposed to you coming into the hospital unconscious or having a massive heart attack, and all of a sudden your entire life changes in just a few hours.
I think one of the significant things you mentioned earlier is the public should be mindful of the fact that what diseases tend to be in your family tree. So if it is your father and your grandfather had, I would imagine, a condition, you may not be experiencing the effects of that condition or laboring under that condition or being impaired in such a way, but the familial predisposition to such a condition should make one more conscious of, where you could be slipping.
Correct. And there's a thing that we do where, let's say someone's dad was diagnosed with having high blood pressure at the age of 45, and now you're growing up. We do not wait until you are 45 to check you for high blood pressure. We would start years earlier. So maybe even when you're 40, we start checking to see if you have high blood pressure, or you should start checking to see if you have high blood pressure. Because if your dad was diagnosed at 45, he might have had high blood pressure for a number of years, but not know it. He was just diagnosed at 45. So you always try to, we call it anticipation. We always try to anticipate the onset of a disease earlier than the youngest known relative who's diagnosed with it.
Let's touch on an area. Prescription drugs, vitamins, antibiotics, and now we have in the public space all these little bush doctors that they come on social media and tell you, come by me, call this number, I'm mixing a bush way to drink. First thing, what is your take on this bush medicine treatment?
My take on it is it's not been studied properly enough, one, and two, we really don't know all what goes into it. So it could potentially be doing more harm than good. No one ever did a study to say we have 1,000 people, we give 500 the bush medicine and we give 500 the actual prescription medication. Let's see what happens after 3 months, 4 months, 5 months. No one ever did an actual study like that. And sometimes these so-called practitioners, sometimes they just add things, well, this work for this work for that. This is when you ask them, well, what in this? Don't worry, just take it now. You don't even know what in it, right? You might be allergic to something or something might react badly. I've actually known of more than one person who ended up developing kidney failure from bush medicine and ended up on dialysis. So I'm not saying that bush medicine, is absolutely out of it and I absolutely don't believe in it and everything like that. But what I would want is an actual properly conducted study before I will put my support fully behind it. Because all medications or most medications nowadays actually do have some sort of basis in either plant or animal sources. They find some tree in the Amazon rainforest and they study it and they realize this, they extract the compound and then they make a medication based on that. But those things go through rigorous scientific processes. The bush doctor does not go through a rigorous scientific process.
I accept that and I'm with you with that. I'm not taking that chance. What about vitamins? So many people say take this line of product, get into this product, and they're selling and they're walking around selling you this. I eating doubles the other day. A man tell me you're eating a set of flour, buy this drink and purge yourself every day. What about the vitamins? I mean, at the end of the day, you can go to a pharmacy. Is there any recommended vitamin, something you can take that is recommended? Because we just throw the bush medicine out the window.
Right. So generally speaking, if you have a properly balanced diet, like I said, you eat a variety of colors, there is no need for the average person to actually take a vitamin supplement. We would recommend vitamin supplements for vitamin deficiencies. So very, very strict vegans, no animal or products whatsoever and everything like that. Certain vitamin Bs are deficient in their diet, we need to have them on vitamin B medications. If you have a deficiency, especially for the ladies who've gone through menopause, they tend to lose calcium from their bones very, very easily. So we would recommend calcium and vitamin D for them. Those are the cases or some of the cases where we would recommend vitamin supplements. The average individual who eats a pretty balanced diet will get all what they need from the diet alone, and there's no need except you think it helps mentally for anyone to really be taking a vitamin supplement. A lot of the times people just want something to take in the morning, so that's why they take it.
Well, I'm one to I enjoy apricot kernels, and you I know you're very particular about that, but they say don't eat more than 3 grains per day, and I do that. As soon as I wake up, I'll drink a cup of water and have my apricot because it's a source of vitamin B17. even though there's cyanide.
Yeah, apricots have cyanide.
But Doctor, I know we clean out of time, but for the folks who have been messaging here, I think you've done a fantastic know it now setting with us here today. Could you say how people can contact you, social media, via telephone? Could you say that, because there are lots of people who are asking questions like that here.
Yeah, so my phone number is 703-0027. And you can check me on Facebook at Ryan Cupidore, Ryon. And then Cupidore is Cupid, like the fellow with the bow and arrow, and then ORE on the end.
Okay. Give me your phone number once again.
703-0027.
Okay. It's been such a pleasure having you on. I certainly hope that you can put together another program, so that based on other factors that do affect people who are, some people are really scared of going by doctors. They think doctors don't tell them exactly what's happening. I think you've been out front and very much straight to the point in your explanations.
Yeah, a lot of the fear of people and doctors is the communication, and they don't think that the doctor tells them enough. The doctor just hands them a piece of paper with some medications written on it and says, "Here, take this." And that's it.
Yeah, I think you are very different. Fareed?
Thank you so much for making yourself available. We will invite you again, and we'll do that soon.
Sure.
You communicate very well, and I think the public is very appreciative of that from the comments
Yes.
you've been getting.
Yes.
And, we want to thank you, and to the listening public, we had Ryan Cupidore today, Dr. Ryan Cupidore. You can check him out on Facebook and check him out right here at Digital 102 FM for our next invitation. Thank you so much. Enjoy your evening, Dr. Cupidore.
No problem, you all too.
Yeah, and to the listening public, blessings out there. David, be safe on your way home.
I will. Thank you so much, Doc.
Okay, take care.
That's it for today's edition of Hard Talk with Dr. Ryan Cupidore on the topic hypertension and health. This is Power 102 Digital Wednesday.